My name is Ashim Sinha. I'm the Director of Diabetes and Endocrinology at the Cairns Base Hospital, and I've been in this position since 2005. Since about 1999, we have been doing very intensive outreach work in Far North Queensland, which includes the Cape District, the Torres Health District Service, and of course the outreach communities within the Cairns Health Service District, which includes Hopewell, Wudgell, Atherton. So our telehealth really started way back in 2005, 2006, when we received hardware from Queensland Health to promote us to communicate with their clients in the outreach clinic. These were to supplement the face-to-face clinic so that what we did, we could follow up effectively with the health professional and clients at the other end and our center in Cairns. When we started initially, of course, we didn't have the MBS item numbers, we didn't have proper referrals, we didn't have sort of proper contacts, who we should contact, who should send us the referrals. So we applied for a project grant, and that project grant essentially gave us a person now to coordinate the entire telehealth program between us at the Cairns Diabetes Centre and all the community centres that we visit for our outreach clinics.
My name is Debi Deans. I'm the Telehealth Coordinator here at the Cairns Diabetes Centre. I am a chronic disease specialist nurse from the UK. At the Diabetes Centre here, we already offer a multidisciplinary team approach, and we offer services via email and telephone, as well as coming here to the centre. So being able to offer video conference clinical consultations was just another way of delivering our service to the people in the remote communities. Telehealth just provides such a wonderful opportunity to engage with patients on a completely different level. We provide clinical consultations one-on-one, which means that team are down here in the Diabetes Centre, and the patient and their family and their carers and whoever else they wish to be there is up at Arakoon or the Cape or TI or whatever. And one-on-one means literally that no other people or no other sites can engage in that process, so it's very confidential.
This model has worked very effectively for us, that apart from the doctors and the nurses who are very willing at this centre to do the telehealth process, we now have a person who essentially coordinates the entire care and links up very, very effectively with the health professionals in the communities, and whether it be doctors or nurses, and the health professionals at this end, whether it be nurses and endocrinologists. So from a primary care perspective, and as how chronic disease should be managed, more in primary care, the specialist only plays a secondary role, an important role, but a secondary role. And so unless the team care approach is there, we are never going to succeed.
The good thing about telehealth consultations is the fact that we can bring in the whole team as and when they're needed. The specialist might sit down here initially with the patient, but then feel that the patient requires dietetics or podiatry or education, and all these people can be brought into the consultation at the same time. Also, as I said before, we encourage the patients to sit there with their family and their carers, and also the team that are looking after them up there, because they're the people that normally end up delivering the care that's been discussed during the consultation. We can receive a telephone call from a GP and actually have the video conference set up within minutes. So it's very immediate for the patient, particularly if they've just been discharged from the hospital down here.
At this centre we have two Aboriginal and Torres Strait Islander health workers. Virginia Coods belongs to an Aboriginal community, and Gina Davis is from the Torres Strait. So we've got both communities here. The role of the Aboriginal health workers in these type of clinics, both face-to-face as well as telehealth, is enormous. There are many reasons for it, right? We will come and go, but these are the people who will stay here. Virginia came to us from the Uchopran Health Service, which is a local community-controlled health service in Cairns. So she's part of our team that visits all the outreach communities, along with the endocrinologist, the diabetes educator, and the advanced trainees.
My name is Virginia Coots. I'm an advanced health worker at the Cairns Diabetes Centre for the outreach team. And for the outreach team, we travel to the Cape and Torres Strait. My role is to be present with the telehealth consultations with the GP, our specialist, as well as a clinical nurse, telehealth nurse. And my role is to play an important part as well for the family member on the other side of the video conference, so they feel a bit more comfortable and are able to get the right information from the specialist while they're in their home communities.
The only other alternative prior to these was for these patients to come and see us, and that would involve a lot of inconvenience to the patient and a lot of difficulty for us to actually fit these patients in our already busy schedule at the Cairns Diabetes Centre. But what we have done now is to formalize this process a bit more. For example, every Mondays between 4:30 and 5:30, the doctors in the Torres Strait have the ability to communicate with us. It's a set time, which means that instead of getting to a place every 3 months, which we can given our resources, we can effectively increase the frequency of the services by using telehealth so that they get a monthly service. The link up that we now have with Torres and Cape every week, I'm sure adds to the benefits that a GP gets, because he or she can just set up a link on a Monday, don't have to wait for me to come back after 3 months and get a face-to-face consultation via telehealth to make those changes. The Torres Bridge also has enabled us to link in with any other doctor that wants to link from the outer islands. For example, we have Dr. Samuel Jones now in Badu, who links up from Badu, or the doctors from Bamaga or York Island. If it is just a case conference where the patient is not there, we can do a general discussion on the patients. And these turn out to be not only case management, but it's a lot of education for the doctors as well.
Well, afternoon, Ashim. As you know from the referral, I've referred through this 56-year-old lady to Mena Ruben for some advice really regarding her diabetes control and perhaps the next medication we could consider. My name's Dr. Sam Jones, and I'm a GP and Senior Medical Officer here on Badu Island, where I service the Near Western Cluster, which is Badu, 2 communities on Moa Island and Moviang. The telehealth service has really been it's been a great initiative particularly over the last year, where we've had some new impetus to actually use telehealth for a broadening sort of spectrum of reasons, both clinical and sort of a conference, like with family meetings as well at the hospital, as well as acute critical care or chronic disease follow-up. Here on Badu, I'd say that now obviously everybody has access to specialist care through telehealth, and whereas before, particularly for the elderly or infirm, for whom travelling down to Cairns was quite arduous and physically sometimes impossible, telehealth has really made all these services much more widely available to everybody in the community. From my perspective, I see that telehealth is really going to improve the coordination of care, to bring about hopefully a really true shared care that puts the patient at the centre of the service provision.
We deliver professional development also via Link, which means that we have to date had as many as 17 different sites linking in at the same time and over 84 participants. This was for professional development, and these were nurses and health workers and doctors all at the same time.
I was recently in Berlin, attended the European Association for the Study of Diabetes meeting, and then I came back, and in one of these conferences or one of these telehealth sessions, I was able to give them an update on the latest management of type 2 diabetes in other parts of the world. So it's not only a consultative process, it's an education process.
The training aspect of it is really important. It connects us. It means that us out here in remote rural locations feel connected to what's happening in the centres. It keeps us up to date, and also I think it also helps to connect people from the urban centres with here on Badu.
I think the best thing about telehealth is the way that you can engage the patients so fully, because you can discuss with them the results. They can have their whole family there, they can have all their support that they need. We can link in professionals and other specialists as needed, and it just becomes a very embracing, very engaging process and very educational for the patient. Telehealth is a very easy process to implement. The important thing about implementing telehealth is the fact that the patient has to be informed and completely aware of the process that's involved.
In a community-wide context, it's very important that people understand that this technology is available, it's nothing to fear. I think the aspects of privacy are very important to develop, as well as translation and communication issues. I think it's very important to have an Indigenous health worker here at this end with the patient. I think that's very, very important.
When I go to communities, I encourage all of our health workers to go to the telehealth machine. I always like to show them how to work it, and it's just encouragement for the health workers, because the minute they do a consult with another staff member, with the patient, to our service here at the Diabetes Centre, the more they'll get used to it, and the more we can all do it, from TI to Bamaga, all the way down to Cairns and Yarrabah.
I think one of the nicest surprises is the fact that, despite the fact these people are a long way away and we're only talking to each other on a camera, we actually develop quite a good relationship. And when you see them down here, it's like we've known each other for years. That's really lovely.
Now, we're also getting requests from outside the Queensland Health to do the telehealth with this centre. So private GPs in remote areas are requesting that. I have used this very effectively in my private practice, where I do not have the luxury of a coordinator. We're now maximizing our billing process using all the Medicare item numbers that have been given for this, so it is generating good income for the centre.
The new accessibility to the MBS item numbers has certainly prompted some increased interest and uptake of services here on Bardu. It just means that there's renewed interest by specialists down south to use this form of communication, and from the districts.
We can actually have that patient linking in with the specialist within minutes, and so the patient and the GP receive the information and support they need straight away. Saves a big journey back to Cairns, a lot of time, a lot of effort, a lot of inconvenience, and a lot of heartache.
I think it's a really exciting advance in remote and rural health. I think that it's the convenience, the saving in costs, both to the patient and the family themselves, as well as to the services, will be significant.
Telehealth is going to become the way medicine is going to be practiced in the near future. In consultative medicine in Australia, between specialists, GPs, nurse practitioners, and other members of the health professional team. I think that's my strong belief. It will happen. It should happen. It's a very effective way of communication, as long as all the parties feel comfortable to do it.